good?
Yes.
Good. Hello. Dr. Alfred Marquez here with Marquez Dental here in El Paso. We're doing another live video, but this time I'm not here by my lonesome self. I have two staff members. I have Vicky in back.
Hello.
And I have Natalie to my right.
Hi.
And they are the experts that work in the front office. And they're going to help us address the topic of making dental care affordable. So I encourage you to ask any questions. If you have any questions at all, just give us a buzz, or you don't give us a buzz. I think you type it in, and we'll be happy to answer questions as we go along. So a little bit, first let's start with Vicky in back. Vicky, how long have you been with me?
For over 20 years.
No way, I haven't even been in practice that long.
Yes.
Over 20 years.
20 years.
Okay. No, she's really great at what she does, and apparently she enjoys what she's doing.
Yeah.
Natalie is over here. Natalie, how long have you been with me?
Over 20 years.
Oh my God, it's contagious. So she's been with me for a good long while as well. In fact, Natalie used to be a dental assistant, and then she transitioned into the front office, and she's been there. And so these are really great staff members I have. I'm very fortunate, very happy that they've been with us for so long. So today's topic, like I said, dental care, and how do we make it affordable? I'm going to try to make this a conversation, and I want them to interject. And guess what? They're camera shy. They're not always like this, sitting down. Just they usually are really talkative, but we'll try to pull them out of it. So when we do our diagnosis with our patients, what we try to do as a group is we're trying to decipher what are the patient's needs, what do they want, what problems might they have. We're trying to make our diagnosis as competent and all-inclusive as we possibly can. And while we're doing that, we want to address the patient's needs and their desires as well, because oftentimes patients are concerned about certain things, and we want to make sure that we address them. Once we address those things, and once we identify what those issues are and what those problems are, and through our modern day diagnosis, we're able to identify things that maybe if we take care of right now at this point will prevent bigger problems from developing as time goes on. And what I've told them is, my patients, is you got to take care early on, because really, in my opinion, dentistry is not expensive. I think we'll find that what's expensive?
Neglect.
Neglect. Neglect's expensive, because what might be a simple problem to fix today, if we wait a couple of years, it's going to turn to a really complex problem. Do you guys agree? Have you ever seen that?
Yes, all the time.
We've seen it. We see it a lot of times where maybe we're saying, you got this simple filling to do, and they say, well, we'll do it later. It doesn't hurt. I'll wait. I don't see it. And then 2 years later, they come in, and then treatment becomes more extensive, and subsequently even more expensive. And we don't want that to happen. So we're trying to make it affordable, because I think really it can be scary, and you say, well, I've got an expense, and I have to pay this, but I really don't want to do it. But the thing is, well, maybe you really don't want to do it, but you really need it, and you've got to understand that the earlier we take care of things, the better. And then there's also some elective things that patients want to do that will be beneficial to them, and they say, I want to be able to do this. So again, Vicky and Natalie are just really well versed in how to is affordable. So we're gonna go over that here in just a bit. What are some of the reasons that our patients will give us as to why, you know, they don't do treatment? What might be some of the things?
There's always excuses, you know, I can't afford it. You
Yeah.
don't even know what you're facing when you're still in Iran. I'm thinking dentistry is expensive. It's not, it doesn't have to. As I said, you know, if it's expensive, you wait, of course.
And then, and what are some other things? Maybe they might feel that they really don't need it,
I don't have dental
or
insurance.
I don't have dental insurance. That's probably one of the biggies, and it's sort of like,
My kids need the dental work. I'll wait.
Yeah, you know,
wait for
and-
myself.
and,
My husband. I have to remodel my house.
yes,
and
or
then
whatever.
cars.
So we need to see how we fit it into a person's budget. Hi, Leticia, I see you there. This is new technology, and I
Hi, Ms.
think
Navarro.
yes, indeed, yes.
Thank you for tuning in.
Thank you for tuning in. Our goal is to, well, let's try to figure things out and make it work for our patients. So let's talk a little bit about one of the big things we get is, well, will my insurance cover it? Will you know, how will my insurance, is my insurance going to pay? But the reality of insurance is, are they going to pay? Does insurance pay for dental treatment? I mean, can you say, in all honesty, that if you have insurance, you're going to get covered for everything that's going to get done?
No, you're not.
Insurance will tell you that you will, and you probably should check your plans to make sure. We will help you maximize your insurance, but really, I think it's just really blown out of proportion as far as what insurance will really do. For example, what's the maximum yearly benefit for most people?
Most people, it's about $1,000 a year.
About 1,000, maybe some,
if we get lucky.
maybe 1,500.
2,000, very rarely.
But this is really interesting. You guys have been with me for over 20 years, or so you say. They have. They've been. What would you say dental benefits were 20 years ago?
Insane amount.
About $1,000.
Haven't even got $20 yet, it's
$1,000. So dental premiums. What do you think might have happened over the past 20 years? Do you think it's gone up or down?
It's gone way up.
Yeah, premiums have gone up. So premiums have gone up. Dental coverage has been about the same, but still, when you say you've got $1,000 worth of coverage, does that mean you're going to get $1,000? Like if you do $1,000 of treatment, are you going to get 1,000? You're not. You're going to get what, a portion of it, a percentage of it, 30%. The other percentage of patient is still responsible. So not only are you paying premiums, you have before you start collecting on the insurance, there's a deductible, and then there's
your preventative.
there are different rates. Preventative is covered at one rate,
100% according to them, and that's what
According
they
to
tell
them.
you. We pay 100%,
which is rarely what we see.
So, but what they don't tell you is that they base it on fee schedule. They have a fee schedule.
They have their own fee schedule.
It's been the same for the last 20
Yeah.
years.
Yeah.
$50 a cleaning, and that's
Yeah.
all they're gonna cover.
And so they're in reality using outdated fee schedules, because who does it benefit?
The insurance.
Insurance company, not the patient. And our focus is, okay, you know, I want the patient to get the best care that you can. So the other thing too is then when we get into restorative, it breaks down into major and what else do they call it? Basic and major. Basic being fillings and things like that, but there it's covered at a percentage only. And then when you get into major, it's 50%. So when you look at all this and the smoke clears, and I think, Natalie, you did kind of a cost comparison, a breakdown. We did a pretend thing where, what did we do? We said, we did a pretend that a patient did a couple of fillings and a crown and whatever. And
I guess we can go over our in-house dental plan.
yeah.
That way we can do a comparison.
Yeah, so we'll talk about what we've come up with to help our patients that don't have insurance and what they can do. And what we have is, it's called our in-house dental plan. Okay? You want me to, Aldo Gonzalez. Aldo, how are you?
Hey, Tito.
Isabel.
Hi, Isabel.
What's for lunch? So, where were we? I got something. Our in-house. So let's talk about our in-house plan. So here's what happens. We have an in-house plan, and I'll let you guys explain what it does for our patients.
So, we had a lot of patients, you can afford to go to the dentist. I have a toothache. I haven't had a cleaning since I was a baby. I never had a cleaning before. I never seen the dentist.
Mm-hmm.
I don't have dental insurance. Well, that's not an excuse. So we came up with the in-house dental plan.
Mm-hmm.
And what this is, I think it's a really good deal. It's $249 a year, not a month. It's a year. For single members, $249, and that will cover your exam, your X-rays, your cleaning, not just once, but twice a year. So you're covered for the year, and then on top of that, you get a 10% discount on any other procedures.
And there's also like additional
And
household.
then you can add your spouse for $199.
So it's even less.
Even less. And then your dependents under 13 for $149 a year.
And
you
so
get all these benefits.
So you're gonna get the cleanings, 2 cleans a year. You're gonna get comprehensive exam, X-rays as needed, exam in 6 months, and so I mean there's no way that insurance can even touch that.
Yeah, so it's our in-house plan. It's not really, a lot of people get confused. Oh, it's not insurance. No, this is better than insurance because we don't have to worry about them.
Deductibles, you don't have, and everything, it's applicable immediately, there's no limitations, no exclusions, so it's a good deal.
So really the savings is over, we did the math, it's about $622 a year.
If you spend,
if you were to,
spend 1,000 or whatever. When you look at the premiums and everything that you would pay with insurance. So we try to do that to help our patients. And what we're trying to do is encourage them to get their periodic exams. We're encouraging them to get their prophylaxis, which is a cleaning. Okay.
Which is a way of prevention.
It's preventive. It's preventive in nature. So I think it's really a good deal. And then even for stuff like cosmetics, stuff like bleaching or veneers or things like that, implants, you're still going to get a percentage that you take off of that. Insurance isn't going to cover any of that.
Yes.
They're not going to cover cosmetic implants or that. They're not whitening. They don't do any of that. So I really feel that this is a good plan and an excellent thing for anybody that doesn't have insurance to do. Even some of our patients that have insurance will go with our plan because it's a better deal.
They'll
it's
just
a much
cancel
better
their
deal.
insurance and they do the math.
And if you
$55 a month.
and if you all have issues with insurance and how it works, just give us a buzz.
And we'll try and help
And
you
we'll
as
help
much
you out.
as we can. We're not going to say no.
Victoria. Hi, Victoria. I see you. I know Victoria. Yes, very good.
Yes, and we're not trying to discourage you from, getting your dental insurance, and we'll help you as much as we can with that.
So, and they're good. Natalie and Vicky are just really good at it, and we want to make dentistry affordable.
We want to see you at least every 6 months, not every 2 years, not every 5 years if you come in with a toothache. So
Yep.
we can prevent all that.
We can prevent it and make it affordable.
We can save you some money too. If it gets expensive, don't wait that long.
So when we do our dental plans, our dental treatment, we want to give our patients options. We want them to understand what it is they're getting. We want them to understand why we're recommending what we recommend. We want to answer questions and have them understand what is working for them, and then how do you do it? Now, when we do the treatment too, do you have to do everything all at once? We can do one.
No, phase it out.
We can phase it out. We can, break it up for you, and maybe you do some of it, within a period of a few months, and then a few months after that. And what happened? You guys.
There you are. I'm here.
No, the camera moved. How come? What happened? Okay, here I am. I'm good. Okay, these guys are telling me to keep going.
Of your face.
So the bottom line is we want you to get the dentistry you deserve, the dentistry you want, and that's what we're trying to do. So anything else that we need to cover that we want to say? We had a question here. Let's see what the question is.